Thank you so much for joining us today for Medicare 101 workshop. Today, I'm going to introduce you to the important consumer assistance programs, SHIP and SMP. I work for the SHIP program, and we're part of the New Mexico Aging and Long-Term Services Department. We're going to go over all the parts of Medicare, Medicare A, B, C, and D. I'm going to explain Medicare enrollment to you, go over your Medicare options. I give you some COVID updates. I keep thinking I'm going to be able to take this part out, but then, you know, something always happens. And things are good right now, but who knows what's going to happen next week or next month. So I'm leaving that in there. And then I'm also going to go over some general resources for you that are just helpful as we grow older. So I work for the New Mexico SHIP program. SHIP stands for the the State Health Insurance Assistance Program. And again, my name is Kris Winterowd. I'm the regional SHIP coordinator. The Northeast is my area, but I also do these workshops that are available for everyone statewide. The SHIP program is a federal partnership. We're contracted with the Centers for Medicare and Medicaid, and I receive ongoing training about Medicare-related issues, new things that come up in Medicare. We do counseling, education, outreach, and the main thing to understand about our program is it is free and unbiased information and assistance. I work for the state of New Mexico, so my only goal is to help you understand how Medicare works so that you can make the best decision for yourself as you start on this next phase. This workshop is for people who are on Medicare, people who are getting ready to start Medicare, family members, caregivers, really anyone, often, you know, people who are caring for older family members really need to understand how that benefit works for them in order to, you know, really do the best job of making sure they're getting the most out of their insurance coverage. So that's also something to think about. If you know somebody in that situation, you might want to recommend them to next month's Medicare 101 session.
Okay.
Another program that's very important is the New Mexico SMP. SMP stands for Senior Medicare Patrol. It's the part of our organization that's dedicated to healthcare fraud prevention. They're there to help Medicare and Medicaid beneficiaries avoid, detect, and prevent healthcare fraud. We know that seniors are such a target for scammers, and they're creative. They're constantly coming up with new ways to try to get people to give their information out so that they can take advantage. If you or someone you know you think may have been the target or the victim of a scam, you can call the New Mexico ADRC at 1-800-432-2080, and you're going to hear that phone number over and over again because it's one-stop shopping. That one number gets you access to all of these programs. And report that, and they'll investigate, and they'll also give you some guidance on what you need to do to protect yourself further. They also help people resolve errors with billing and with illegal marketing. I mean, so it's really horrible. I've helped any number of people who have just simply spoken with someone trying to get information and found that suddenly their Medicare coverage was changed because the person that they spoke with signed them up for their plan, even though they did not intend to do that. So if anything like that happens, there is a resource for help. So diving into Medicare, Medicare is health insurance for adults 65 or older, and it also goes for younger adults with certain disabilities. Basically, once someone has been on Social Security disability for 2 years, they're then eligible for Medicare. And anyone with end-stage renal disease, regardless of age, is eligible for Medicare as well. When you turn 65, a person qualifies for Medicare if they collect or qualify to collect Social Security or railroad retirement benefits, or the person is a current U.S. resident and either a U.S. citizen or a permanent resident who's lived in the U.S. for 5 years in a row before applying for Medicare. Sometimes people turn 65 and they're not yet collecting Social Security. In that, if you are collecting Social Security, you're going to automatically get your Medicare card, and they're just going to start deducting the Medicare Part B premium from your Social Security check. If you're not yet collecting Social Security, and I talk to more and more people who are delaying collecting Social Security until, I think it's 66 and 4 months, because the percentage goes up. And I even talk to people who wait to start collecting Social Security until they're 70. So if you decide to wait to collect Social Security, you will have to apply for Medicare Part B through the Social Security Administration. And if you need help with that, you can call us. We'll guide you through that process. So as I mentioned before, if you're not yet 65, you may qualify for Medicare if you have been receiving SSDI for 24 months. And again, if you have ALS, there's no waiting period. You're eligible immediately once you start receiving SSDI. And then anyone who has end-stage renal disease. In that case, you don't have to have enough work history as long as a family member does. Do you have any questions about getting started with Medicare, how you get those two most basic building blocks, Medicare Part A and Part B?
I don't think so. My husband already has his Medicare card,
Right.
and it does say Part A and Part B on it. So I think you're clear on that, Nathan?
Yeah, I guess it's going to happen. The only switch I have to do is once I apply for the New Mexico healthcare.
Right.
And then that you'll cover that, I'm sure.
Right. Okay. So as I mentioned, if you're already receiving a Social Security check, enrollment is automatic, and it sounds like that's the way it happened for you.
Yes.
The initial enrollment period begins 3 months before you turn 65, includes the month that you turn 65, and continues for 3 months after. So it's a 7-month initial enrollment period. You have a lot of time to make these initial decisions. Although in order to avoid a gap in your coverage, it's best if you get your decisions taken care of in that 3 months before you turn 65.
Yes.
If you miss your initial enrollment period, that 7-month period that we just discussed, every year from January 1st to March 31st is the general enrollment period. And right now, if you enroll during the general enrollment period, your coverage is going to begin July 1st. And this happens sometimes for people. There's some talk of eliminating that 4-month waiting period for your enrollment to actually begin on July 1st, but it hasn't actually happened yet. I've got my fingers crossed. You're also eligible for a special enrollment period if you move, if your employer coverage ends, or if you're entering or leaving a long-term care facility. This is especially relevant for people who are continuing to work after age 65. You don't have to start your Medicare at age 65 if you're still covered under active employer insurance. And if that is a person's situation, then when their employer coverage ends, they get a special enrollment period to enroll in their Medicare. So you've already got your Medicare card. Looks like this, the red, white, and blue card. It has your 10-digit Medicare ID on there. That's a mix of letters and numbers. The Medicare cards used to have the Social Security number on them. They changed them several years ago to reduce people's exposure to potential fraud. If there's anybody watching this who does still have their Medicare card that has their Social Security number on it, you do need to replace that, and we can help you with that if you need help with it. If you are automatically enrolled in Medicare and you're still working and covered with your employer health insurance and you don't want to enroll in Part B right away, the instructions for declining Part B are on the back of your card. You just follow those instructions. That's the only circumstance that I would recommend declining Part B. If you feel that you need to decline Part B because you can't afford the premium, please call us. There are some assistance programs that help with the Part B premium for people on limited incomes. And I'm going to go over them later in the presentation. But you really don't want to decline Part B unless you're still covered under active employer insurance, because it creates a whole host of problems if you decide to enroll later. Okay, so I think of Medicare as a set of building blocks, and depending on how you put those pieces together, that's going to determine the type of coverage you have. Everyone needs to have Medicare Part A and Part B, and we'll go over that in detail in just a minute. So no matter which type of coverage you choose, whether you go with original Medicare or a Medicare Advantage plan, you're going to need to have both Part A and Part B. If you add a Part D prescription drug plan, then you have what we call original Medicare. Original Medicare, you're getting your coverage directly from Medicare. Medicare pays 80%, you're responsible for 20% of the cost of your care. You can see any provider in the country that accepts Medicare. So the big draw for this type of coverage is that it's flexible and you have the maximum amount of choice in terms of who you're going to see to treat your medical conditions. People can add a Medigap policy or a Medicare supplement that's referred to both ways interchangeably, Medigap or Medicare supplement. The supplements are there to pay your 20% of the covered benefits. So if you had original Medicare with a Medigap, you're going to have low to no out-of-pocket costs when you go get your care, and you can go see anyone you want who accepts Medicare. This type of coverage has higher monthly premiums because you have the Medicare Part B premium, you have a premium for your prescription drug plan, and you have the premium for the Medigap policy. Those are pricey. They're expensive. My rule of thumb, if I'm talking to people about whether or not this is the right choice for them, you always have to consider your budget. And my rule of thumb for people is expect to double your basic insurance costs if you go with original Medicare with a Medigap. So right now the Part B premium is $170 plus your drug plan premium. So I mean, you would expect to pay something like $350 a month for your premiums combined with this type of coverage. So for many people, that eliminates it as an option. But if you can afford it, it's a great type of coverage. The other downside of the original Medicare is that it does not include any dental, vision, or hearing coverage. And so if you want that coverage, you're going to have to enroll in a separate private policy for dental, vision, or hearing. Congress last year did vote to include hearing coverage in Medicare, but I should look it up before the next seminar, our next workshop. I'm not sure when that's starting. I know didn't start in 2022. I'm not sure if it's going to start in 2023. I need to check into that. So really the benefits or the pros of original Medicare are that it has a lot of flexibility and choice. And the cons are it does not include the dental, vision, and hearing, and you do have a higher monthly premium. Of course, the flip side of the higher monthly premiums is if you do get care, you have low to no out-of-pocket costs. And I'm going to go over later in the program how to look at the Medigap policies. So the other type of coverage is a Medicare Advantage plan, also known as Part C. And with this type of plan, it bundles together your Part A hospital coverage, Part B doctor coverage, and a Part D prescription drug plan into an HMO or a PPO that's offered through a third-party insurance company. So you're no longer buying your insurance directly from Medicare. Now you're buying, it's still Medicare, but you're getting it through a third-party insurance company. You cannot have both a Medigap and an Advantage plan. So it's one or the other. You can't have both. With a Medicare Advantage plan, you're going to have lower monthly premiums, but you're going to have higher out-of-pocket costs for your care. And again, how this sort of balances out for any individual financially really depends a lot on their health conditions. If you have low health care needs, a Medicare Advantage plan is probably going to make a lot of sense. When your health care needs go up, a Medigap policy can actually, even though it has a higher monthly premium, it can actually save you money because you're not being hit with co-pays every time you go in for a test or a specialist appointment, a procedure. You don't have any out-of-pocket costs. Whereas with a Medicare Advantage plan, every time you do anything, you're going to have a copay. The Medicare Advantage plans do often include some amount of dental, vision, and hearing. You have to be really careful when you look at them to make sure that you're getting what you think you're getting. And we offer a lot of assistance with that. So if you're looking at Medicare Advantage plans and you want to make sure you're getting what you think you're getting, we're happy to talk to you about that and talk you through how to look at the plan details so that you don't have any surprises once you enroll in that coverage. Do you have any questions about just kind of this basic decision? This is the most important decision you'll make as you enroll in Medicare. One thing to consider is when you first enroll in Medicare, you have what's called a right of guaranteed issue period for the Medigap policies, those Medicare supplements. And what that means is if you decide to enroll in one of those plans, they have to just sign you up. They can't do a health screening. They can't decline you based on pre-existing conditions. Once you're outside of that right of guaranteed issue period, they can, and they will. It can be much more difficult to get a Medigap policy if you try to do it, you know, somewhere down the line after you've started Medicare, whether it's anytime outside that first year. Because if you have any health conditions at all, if you take any medications, they can decline you. Or if you do manage to find a policy that will enroll you, they can charge you more. So if you think you might want to go with the original Medicare option, it's probably best to do it from the beginning. Now, in your case, Jody, and I'm sorry, I forgot your husband's name. Ted. In your case, Ted, one of the great things about getting your healthcare coverage through the New Mexico Retiree Healthcare Authority is that they do allow you to switch between their original Medicare plans and the Medicare Advantage plans, which you do not find outside of an organization like that. So, for example, if you want to keep your healthcare costs down now, your monthly costs down now, because your healthcare needs are low, you can enroll in a Medicare Advantage plan. And if you find in 5 or 10 years that your healthcare needs have changed and you think it would make more sense for you to enroll in original Medicare with a supplement, you can do it during the New Mexico Retiree Healthcare Authority's open switch enrollment period, without having to go through the underwriting process and without the worry that you'll be denied based on your health conditions. And that's part of the reason that the supplement that's offered by the Retiree Healthcare Authority has a high monthly premium, because they offer their members that flexibility, which you do not find outside of that organization. So that's something to keep in mind when you're trying to make this initial decision. Before we move to the next slide and start getting into the details of the different parts of Medicare, do you have any questions?
Well, I'm sorry, this is still kind of confusing for me. Since he has the retiree health insurance and he has his Medicare, does he still need to have the Medicare Part B since he has like his regular insurance?
So if he is retiring, if it is, Ted, are you on retiree? Do you have a retiree plan or are you active employer plan?
It's a retirement.
So you have to switch over to Medicare.
Right.
Yes.
Yeah. And
But
so
he also needs to stay on his press because otherwise I'm not covered on it.
no, that's not true. So you can continue to be on your current plan, Jody, and Ted is going to switch over to one of the Retiree Healthcare Authority's Medicare plans.
Oh.
Right. So one of the things that happens with Medicare that often is like a little bit confusing for people, we're very used to having our insurance connected, right? Where both spouses have to have the same thing, right? Because you don't, and that's not the case anymore.
Okay.
You can have, you can enroll in different, and once you become Medicare age, Jody, you don't have to both have the same plan, right? Right now, as Ted ages into Medicare, you can't have the same plan anymore, right? Because he has to switch over to a Medicare plan and you're going to continue with the one that you have now. Once you're also Medicare aged, if he decides to carry you still through the Retiree Health Care Authority, well, you have the option at that point, Jody, to just get your own Medicare based on your own work history and benefits, and you don't have to continue to have your insurance attached to TED.
Okay.
Okay. You could, right? You could continue to go through the Retiree Health Care Authority, right? And at that time, you'll attend another seminar and ask those questions, but you don't have to. Okay, so it's really it's a divergence, right? This becomes an individual benefit at this point. Does that make more sense?
I think so, because I think we were under the impression, and I think Ted was even told that if he wasn't under the we have Presbyterian, if he wasn't under Pres, then I wouldn't be covered because I'm under his insurance.
No, because he's going to be switching over to a Medicare plan and you can't switch over to a Medicare plan. So you're going to have different coverages.
Oh, okay.
Right?
Okay.
Okay. So I don't think your insurance needs to change, Jody. And then Ted will enroll in whatever makes sense for him. But when you do that, when you speak to the customer service people at the Retiree Healthcare Authority, run your situation past them. They deal with this all the time. It shouldn't be,
okay,
a big deal.
Okay.
Okay. So Medicare Part A is the hospital coverage. It covers your inpatient hospital stay, skilled nursing facility, covers the first 3 pints of blood should you need that. It covers home health care. I want to explain this a little further. Home health care in this case means skilled nursing, occupational therapy, physical therapy, following some sort of a procedure that's ordered by your doctor. It's not in-home caregiving services, generally speaking. Okay, and it also covers hospice care. Most people don't have a premium for Part A. If you paid into the system for at least 40 quarters or 10 years. If you paid your FICA taxes less than 10 years, there is a premium for Part A. If you're on fixed or limited income and you can't afford that premium, please call us because we can most likely help you be able to get premium free Part A, but the process is a little bit convoluted and it's difficult to navigate by yourself. We're happy to help with that.
Okay.
Most often the people who find themselves that I've worked with that find themselves in the position of not being eligible for free Part A are people who are disabled, been on disability for a long time, and weren't able to, work those 10 years, or who, are worked in kind of an off the grid occupation where they didn't pay into the taxes, artists, people, Native Americans in traditional occupations, things like that. Sometimes they don't have the work history necessary to get premium free Part A. In those cases, please, like I said, please do call us. We can help. If you don't enroll when you're first eligible, there are penalties. If you accrue penalties, you pay those penalties forever.
Oh,
So you don't want to do that because nobody likes to be punished for the rest of their lives. So before you make a decision to not enroll in any part of Medicare, please give us a call because we can guide you through that situation and make sure that if whatever decision you make, you understand the repercussions.
Hmm.
Part B is the medical insurance, and it covers your doctor visits, outpatient surgery and supplies, labs like x-rays, MRIs, CT scans, EKGs. It covers durable medical equipment, the diabetic supplies, not the medication, but the test strips, needles, all of that sort of thing. And it also includes a variety of preventive services that Medicare covers for free.
okay.
Okay. In 2022, the standard Part B premium went up to $170.10. The deductible is $233. And in general, if you have original Medicare, the coinsurance is going to be 20% for most services. Some preventative services have no copay. Outpatient mental health services and copays for hospital outpatient services are also 20%. And so is durable medical equipment. If you enroll in a Medicare Advantage plan, you're going to have a set copay for each of those things. So,
Okay.
and it varies wildly from plan to plan. It's never going to be more. It can't be more than 20%, right? So when you enroll in a Medicare Advantage plan, it can't charge more than Medicare allows, but it can charge less.
Okay.
Okay. Often the copay is essentially 20%, but depending on the plan, it can be less than that. So if you're thinking about Part B and whether you want to enroll or not, we don't recommend opting out or delaying enrollment unless you're covered by your own or your spouse's active employer group health plan. If you're covered under a retiree plan, you need to start Medicare because basically, if you're on a plan that Medicare does not consider creditable coverage, then you will accrue penalties. And the penalties are 10%. So that would be $17 a month with the current premium. So your premium would go from $170 to $187.
Okay.
And that's if you have 1 year without coverage. And it's not worth exposing yourselves to that kind of penalty situation.
Okay.
So COBRA is not considered an active employer group coverage or retiree coverage, right? And also many retiree plans, for example, if you have TRICARE for Life, you're required to have Medicare Part B coverage, or the plan won't pay. And I've actually worked with someone who thought he had coverage, but since he didn't enroll in Part B because he thought he had coverage, and the plan required Medicare to be the first payer before it would pay, he ended up, you know, in kind of a bind because he essentially did not have insurance. He had to pay out of pocket. So please, if you're considering not enrolling in Part B, call us, because we don't want to see anybody finding themselves in a bad situation with inadequate coverage. And again, that number is 800-432-2080. So if you kind of miss your window on Part B, the Part B late enrollment penalty is 10%, as I mentioned before, for each 12-month period, and it goes on forever. So if you miss 1 year, that's an extra $17 a month at the current premium rate. 2 years, that's $34 extra a month, and it can really snowball on people. And you know, put the premium can put getting the coverage out of reach for people. We don't want to see you in that situation. There is a special enrollment period for people who had active employer group health benefits, and worked past age 65. You know, I've talked to people who retired age 67 or 68. And at that point, you do get a special enrollment period. You have to enroll in Medicare within 8 months of losing your employer coverage. Most people, of course, do it. As soon as you know your retirement date, you can apply for Medicare Part B, and then it should be seamless, your coverage.
Okay.
Okay. If you're thinking original Medicare with a Medigap policy is the type of coverage that makes sense for you, it makes sense to enroll in that as soon as you're eligible. Because as I mentioned before, you can run into problems if you don't have a right of guaranteed issue period. If you're enrolling in a Medicare Advantage plan, you have to have both Part A and Part B. TRICARE for Life, as I mentioned on the last slide, also requires Medicare to be the first payer. So you need to get at least Medicare Part A and B. And sometimes your employer or retiree plan, as I gave you the little anecdote before, requires Medicare to be first payer. So you really need to speak with your employer HR to make sure you understand the requirements for continued coverage with the plan that you have. And of course, you can always call us. And again, it's 800-432-2080. Okay. If you enroll in original Medicare, you have to enroll in a separate Part D plan. If you have a Medicare Advantage plan, you need to double check and make sure that it includes Part D prescription drug coverage, because not all of them do. And having prescription drug coverage is really, really important, even if you're not currently taking any medication. If you don't enroll in a Part D plan, you're also exposed to penalties that continue through forever. They're a lot less because these plans are less expensive, but still you don't want to have to pay penalties. And I talk to people all the time who are like, well, I don't take any medications. Why should I get a plan? And I remind them that, you know, we don't have insurance necessarily. I mean, obviously, yes, we want it to cover our current needs, but it's also there in case we have future needs, because our health conditions can change without warning. Right? So you may end up needing a medication, and you do not want to have to be paying for these things out of pocket. So the outpatient prescription drug coverage are all through third-party private insurance companies that have contracted with Medicare to provide a plan.
Mhm.
The covered drugs and the formularies vary wildly from plan to plan. And also so do the premiums. So this is something where you don't want to just sign up for a plan because you've heard of the name of the company that's offering it. You definitely want to work with someone. We do this with people all the time, both the options counselors who answer the phone in the Aging and Disability Resource Center and the SHIP coordinators such as myself. We help people get into a plan that's really going to meet their needs all the time. And I will also show you how to do that yourself because the information is freely available through the plan finder on medicare.gov. And as I mentioned before, it can vary wildly. Thousands of dollars a year difference is possible. So this is definitely an area where you want to make sure you've done your homework. In order to get a Part D prescription plan, you have to have either Part A or Part B. You don't actually have to have both. So if there's somebody who has opted out of Part B or didn't qualify for free Part A and didn't know how to get the help to get it, you can still have a prescription drug plan. They're local. They have each plan has a service area, so the same plan may not be available in Las Cruces and Taos, right? So if you move, you're going to have to change plans, even if it's within the state. And again, we really recommend that people join as soon as they're eligible, enroll in a plan. The maximum allowed deductible is $485. And again, plans vary wildly on this. Many plans, charge the maximum deductible. Other plans have lower deductibles or no deductible at all. It varies a lot from plan to plan. If your plan has a deductible, that does not mean you're paying full price for all your medication until you meet that deductible, but you are paying a higher copay. The base national average monthly premium is $33.06. Their plans, the lowest plan that I've seen here lately is about $7 a month, and they go up to over $100. So it varies wildly. And it really pays to input all your medications through the Medicare.gov website in the plan finder to see how any plan is going to cover your prescription drug costs before you enroll. People tend to think that, you get what you pay for. And so if you take one of those low premium plans, it's going to end up, it's not going to cover you very well, but that's not necessarily true. So we're happy to walk you through that process, or I'll give you the basic information on how to do that here in a minute. And the co-payments or co-insurances depend on your prescriptions and your plan. The penalty for late enrollment in a Part D prescription drug plan is 1% of the national base premium multiplied by each month you're not enrolled, and you carry that penalty forever. So for example, in this example here, if you went 2 years without having a prescription drug plan, that's 1% of 3306 is 33 cents times 24 months means your penalty is going to be $7.92 a month. That's added on top of whatever the premium is for your drug plan. Okay, for those basic parts, Medicare Part A, B, C, or Medicare Advantage plans, and D, do you have any questions for me right now?
I don't think so.
No.
I don't think so.
Okay. Well, it's a little bit clearer than mud now, I hope.
A little bit.
Yeah.
I just have a hard time with the insurance. My husband always deals with it, and now I have to understand it. So it's like, brain block.
Yeah. Well, the important thing, Jody, is to know that you can call us and we'll help you. We'll walk you through it. as many
I
times as
appreciate
we
that.
need
Yeah.
to. Yeah, because people do get, it's overwhelming, but it doesn't have to be that. I mean, it feels complicated to people because it feels like such a big decision,
Mhm.
but we can break it down into manageable chunks, right?
Okay.
Help you
Appreciate it.
understand.
Yeah.
So if you do decide to enroll in original Medicare, that would be the Part A hospital coverage, Part B doctor coverage, a Part D prescription drug plan, and you want to get a Medigap policy to cover that other 20% so that you don't have out-of-pocket costs when you get your health care once you've met your Part B premium, then that's what the Medigap policies are for, to cover that
Okay.
20%.
Mhm.
There are a variety of Medigap policies, and I'm going to show you a chart in a minute. So it's not just one. The New Mexico Retiree Healthcare Authority only offers one. It only offers a G, Medigap Plan G, but there are other ones, and they cover the basic Medigap policy benefits. They don't all cover the same things, and your costs are going to vary based on how many benefits the plan covers. And they're identified by letters, and they're, again, sold through private insurance companies. And this is kind of what it looks like. And I know this is small. You're not going to be able to see this very well. If you go to medicare.gov, you can access the chart right there on the website. But basically, down the left side are the benefits that are covered under a Medigap policy. And across the top are the letters of the alphabet that identify each plan. Okay, so you can see if there's a yes, it means yes, that plan covers your 20% of the costs. If there is a percent, like over here under the Part B co-insurance or co-payment,
Mhm.
the K plan covers 50%. And what that means is it doesn't pay your whole 20%, it pays 10%, and you're still responsible for 10%, right? So this plan, a K plan, is going to have a lower premium, a lower monthly premium, because it covers less, right?
Mhm.
And so you're going to want to look through, really pay attention to what the benefits are that can be offered under a Medigap policy are, decide which ones are important to you, and make sure that the plan that you consider is covering that. For example, down here, when we get down here to skilled nursing facility,
Mhm.
to me, this is one of the most important benefits. And when you're 65, you're not thinking about, am I going to be spending time in a nursing home or a rehab?
Mhm.
But that's why you have this policy, because by the time you're 80, you may need a knee replacement or a hip replacement and have to spend some time in rehab once you have that surgery.
Mhm.
And you don't want to be paying 20% of the cost of a nursing home or a
Right.
rehab. That is, I mean, right now it's, almost $300 a day. So if you have a Medigap policy that covers that, you don't have any out-of-pocket costs. So some plans don't, like A and B, don't cover skilled nursing facility or rehab. And these other ones do. There's a yes. And of course, the K covers 50% and the L covers 75%. So you would still have a copay in that case, but it would be less. So for people who are considering a Medigap policy, I always recommend the first thing you do is spend some quality time with this chart. Make sure you understand what the benefits are. Think about what your needs may be in the future and choose a plan according to that. Oftentimes, people just get recommendations from friends or family members who are already on Medicare. And that's all well and good, but it's still important for you to understand what's going to be covered depending on what plan you choose.
Mhm.
Medigap plan, a Medigap plan is a Medigap plan, right? Every Medigap A is going to cover these same benefits the same way. Again, the premiums vary wildly, even though the plan is covering the exact same benefits. It's really, really important to understand why those premiums vary so much. When it comes to Medigap policy, there are 3 different pricing structures. There is attained age pricing, and what that means is the premium is based on your age, and every year your premium is going to go up. I've talked to many people who enrolled in a Medigap policy when they turned 65, and now they're 75 or 80, and they're like, why does my premium keep going up? I can't afford this anymore. What can I do? And so I just feel it's so important for people to understand what's going to happen to the premiums of their Medigap policies over the life of the policy. Almost all of the policies that are available are attained age pricing. There are 2 other types of pricing. They're community pricing, and the policy that's available through the Retiree Health Care Authority is community pricing. With a community pricing policy, everyone who has the policy pays the same premium, and the premium doesn't change from year to year. You know what it's going to be. It shouldn't change. And what happens is the risk is spread over the entire pool of people who have that policy. Okay. Generally, just like with the Retiree Healthcare Authority plan, it is a higher premium. So if you look at a policy and you're like, well, why does this one have a $75 a month premium and that one's $250? This can help you understand why, because of the different pricing structure. The third pricing structure is issue aged. This type of policy, your premium is going to depend on the age you are when you buy the policy, when you enroll. It also should not change from year to year beyond, potential cost of living or increases, but small and not frequent increases. It's going to be kind of in the middle in terms of the spectrum of potential premiums for these plans. This is the thing that, usually I have to spend some time talking to people individually about if you're considering this. So don't hesitate to give us a call if you want more information about this. You can also find the information on Medicare.gov. Do you have any questions about Medigap policies right now?
I don't think so.
Okay. All right, we're going to dig into Medicare Part C or Medicare Advantage plans a little bit now. It's really, oftentimes people think they don't have Medicare if they enroll in an Advantage plan. They're like, oh, I don't have Medicare, I have Presbyterian, or I have, whatever the company is that they bought their Medicare Advantage plan from. But that's not true. It's still Medicare. It is run by a private insurance company that's contracted with Medicare. Most plans include Medicare Part A, B, and D, but they don't necessarily include a drug plan. So you have to double check and make sure. If you're getting it through the Retiree Healthcare Authority, I think they offer a separate drug plan. So that doesn't necessarily apply to you. You have to have both Part A and Part B to join a Medicare Advantage plan. Like the drug plans, they're local. So if you move to a different area of the state or out of state, you're likely to have to change your Medicare Advantage plan. Okay, so each plan has its own set of deductibles, premiums, rules. So they're all going to be different. The maximum annual deductible is $233 because that's a deductible for Part B. The plan can have a deductible up to that amount. That can be less than that, can't be more than that. You are still, if you enroll in a Medicare Advantage plan or Part C plan, you will still be responsible for paying the Medicare Part B premium, plus whatever the premium is for your Medicare Advantage plan. They're all over the place, everything from no additional premium for your Medicare Advantage plan up to, you know, $180 a month. So there's a lot of variation on that. There's also a lot of variation from plan to plan on the copays and coinsurance. It really depends on the plan. It's impossible to talk about this in a general case. We do assist people with assessing the Medicare Advantage plans. We're happy to help with that. You can get that assistance by calling 800-432-2080. If you're going through the Retiree Healthcare Authority, you should be able to call their customer service number and they should walk you through it. And it's also freely available through Medicare.gov through the plan finder. And we'll, as I mentioned before, we'll go over that in a minute. Once you're in a Medicare Advantage plan, you're really going to need to work with your plan to get any plan details.
Mhm.
There are different types of Medicare Advantage plan. Here in New Mexico, almost all the plans are either HMOs or PPOs. There are also plans, I'm not sure I've even seen one that's a private fee for service, but it is an option and we may get that in the future. Depends on what companies are offering here in New Mexico. If you qualify for Medicaid, in addition to Medicare, you might qualify for a special needs plan. Those are for people who have both Medicaid and Medicare. And then there are a few medical savings account type Medicare Advantage plans available in the state now. A Medicare Advantage plan has to cover whatever is covered by Medicare Part A and B, the basic coverages that we went over earlier in the presentation, but they can include additional services, such as, you know, they can bundle in the prescription drug coverage, vision, hearing, dental. Some of them offer meals for short duration. They may offer a transportation benefit. Some of them have a fitness benefit. One of the things that people love often about their Medicare Advantage plans is an over-the-counter drug benefit where you can get supplements and other supplies from the pharmacy. So at the very least, a Medicare Advantage plan has to cover what Medicare covers, but it can include these additional benefits. And it, again, it varies wildly from plan to plan. Okay. Do you have any questions about Medicare Advantage plans in general?
No.
Okay. So I highly recommend that people go on to Medicare.gov. When you go to Medicare.gov, there's a digital version of the Medicare and You handbook available online, right? You can download it onto your computer and you can that's really your resource guide for what Medicare covers and just kind of the basic information. And most people, you should get it in the mail, but they're shifting away from that. They're really, you know, not wanting to print those as much. If you didn't get one or you can't find it, you can always access it online at Medicare.gov. And you can see, you can request a handbook, you can just get it online.
Okay.
All right.
There's also, Medicare, you can create an account on Medicare.gov. I highly recommend that. When you create an account, all of your Medicare information is accessible to you. You can see your Medicare summary notices. You can see what your coverage is. You can get a variety of information through your account on Medicare.gov. You can print your card if you lose it. You can do all kinds of things. One of the things that Medicare just started in the last year is some specific information for people who are new to Medicare to help you get started help you really understand what benefits are available through Medicare, because it is a different type of coverage than people are used to. And you can just go in here, go to get started with Medicare. You can go through a little presentation kind of like this that just, you know, gives you the basic information about the parts of Medicare. You can look at different scenarios with different types of coverage based on your own situation. You can enroll in a plan. You can go to the plan finder, see what plans are available in area, and you can actually enroll online through medicare.gov. And it has a really handy little checklist to help you kind of see what you can do during your first year on Medicare and make sure you're not missing out on some benefits. So it's kind of a fun little thing that I recommend people explore. In your situation, Ted, with getting your coverage through the New Mexico Healthcare Authority, you're not going to want to enroll in a plan through here. You're going to need to do that through the Retiree Healthcare Authority. But you can still access this other information. Okay.
Right. Okay.
I always like to give people some information about how Medicare works with Medicaid. For people on a fixed or limited income, there are some Medicaid programs that help keep the costs down and make Medicare affordable for people. Medicare is a federal benefit. Medicaid is a state benefit. So these two programs work together to help keep your costs at a reasonable level. The most important benefit is a partial Medicaid benefit called the Medicare Savings Program. It covers the Medicare premium costs for limited income beneficiaries who qualify. This is an income-based program. It does not consider assets. So it looks only at your monthly income, not at what you have in the bank or if you have other investments or properties. It's also not subject to Medicaid repayment, so you don't have to worry. Sometimes people have heard that if you get Medicaid benefits, you may have to repay that. That's not the case with Medicare savings programs. There are 3 different categories of this benefit, depending on your income. It's super easy to apply online at www.yes.state.nm.us. If you don't have access to a computer, you can call us at the ADRC at 800-432-2080, or you can just call me. I'm going to give you my phone number at the end, and it's also in the chat. And I will help you apply for this online, even if you don't have a computer or you're not comfortable with that on your own. There's also a paper application available, or you can apply at any income support division office. I highly recommend anybody on a limited income, I highly recommend you look into this benefit because, you know, $170 extra a month is nothing to sneeze at. So another really important Medicaid benefit is the home and community-based waiver. It's also known as Centennial Care. Centennial Care covers a bunch of different programs. This is one of them. This benefit is a full Medicaid program for people who need in-home caregiving services. It has both income and medical eligibility requirements. You have to meet nursing facility level of care. And what that means is you have to just have a high level of need of caregiving in order to be able to stay safely in your home. The idea is to keep people in their homes rather than in a facility. Most New Mexicans that I've talked to really want to age in place. They don't want to leave their homes and communities and have to live in a nursing facility. So this program is there to help people be able to do that. The application process starts at the ADRC, and that's that 1-800-432-2080 number. And there's an assessment that takes about a half an hour that you do over the phone with the options counselor. That's the only way you can apply for the benefit. You cannot apply for it directly from Income Support Division or on Yes New Mexico. And that's because it's not just an income-based program, it also has that medical eligibility. And so there's the assessment that the options counselor has to do that's a necessary part of the application process.
Okay.
The other important program that I want to talk about is the institutional care waiver, and this is for people who are in a nursing facility. You have to be in the nursing facility. Usually the social services director at the skilled nursing facility will help people apply. But if you're having trouble with that, you can, of course, always call us. We'll be happy to help. And you can apply for this benefit directly. And the reason for that is they're only going to have to look at income eligibility requirements, because by definition, if you're in a skilled nursing facility, you're at nursing facility level of care. So the application process for the institutional care waiver is a little simpler. And I always like to mention this because even though most of the people that attend the Medicare 101 workshop aren't at this level of care yet, they may very well have family members who are friends who are, right? I know we're all, I'm in the sandwich generation. I've got older family members that I'm, taking on a caregiver role for, as well as my children. And so it's important to have the information.
Mhm.
Okay. Do you have any questions about either of these programs?
I don't think so.
No.
The important thing that I will say again is if you have any questions about any of this, you're going to give us a call at 800-432-2080.
Yes.
All right. And even if you just like, what happened? I seem to remember something. All you got to do is call us. We'll be happy to help.
Okay, great.
So
Thank you.
when you do call that 800 number, 800-432-2080, you're going to reach the Aging and Disability Resource Center, or ADRC. You're going to speak to an options counselor. They're going to ask you what they can help you with. It's important to know that the ADRC is not, we're not a direct service provider. What we are is like the clearinghouse for just a host of aging and long-term service department programs, other state, federal, local, public, private. What we're going to do is listen to what your needs are and try to connect you with your local resource to meet that need.
Mhm.
Another big thing that they do is the home and community-based waiver registration and assistance, follow-up. A lot of times people need to update their information or check the status. You call the ADRC for that. We have access to a wide variety of resources. Before this workshop, I was at a training to learn more in depth about the resources available in Albuquerque in particular. We get ongoing training about resources throughout the state. We also offer short-term assistance. Often there are people who need help filling out applications or connecting with resources. Maybe they have special needs and need advocacy. We do all that kind of assistance. The State Health Insurance Assistance Program, you have access to us through that same number, and also the Senior Medicare Patrol that I told you about earlier. Another really important program is our Prescription Drug Assistance Program. Sometimes people, even with insurance, find that the copay for their medication is just too high and they can't afford it. It's a terrible situation when people find themselves either having to prioritize getting their medication over other basic needs, or ration their medication because they want to make it last longer because they can't afford it. We don't want anybody to not take their medication as prescribed, right? That is a life-threatening situation. And so if you find yourself in that situation or know anyone in that situation, please give us a call. We'll make a referral to our Prescription Drug Assistance Program, and they will gather some basic information and connect people with a pharmaceutical company's patient assistance program. And often we can help people get their medication for low to no cost.
Mhm.
You can also reach us through our website at www.nmaging.state.nm.us. There's live web chat available 5 days a week from 8 to 5. Sometimes if people just have a quick question, they prefer that. It's also really good for people who have hearing issues and it's difficult for them to talk on the phone. And realistically, right now, our ADRC is understaffed and wait times can be longer than people like. They're certainly longer than we like, and I'm sure they're longer than you like. And in that case, you do have the option of leaving a message and getting a call back, but you can also switch over to the web chat, and often you can get your question answered quickly and easily that way. If the web chat agent can't answer the question, they'll make a referral to the SHIP program and you'll get a call from myself or one of my colleagues.
Okay.
All right.
Okay. I want to just go over a little bit of information about how Medicare covers COVID-related costs. It does cover testing, right? So if you need a test, a COVID test that's ordered by your doctor, it will be covered by Medicare. You're not going to have any copay. Okay, that's what the third bullet is about there. It covers antibody treatments. So even though I've got my fingers crossed that this, that we're getting the situation under control,
Yeah.
I still think it's important to know how it's going to be covered because
Mhm.
it's unpredictable.
Right.
Of course.
Okay. Medicare does cover telehealth visits. This is a pandemic expansion of coverage, which they're talking about making permanent, and I really hope that they do, even though it's, I think always preferable to see your doctor in person. It's not always possible, and it's not always the most convenient. So telehealth is covered. And so on that second bullet, it says this is related to the pandemic. I haven't gotten the confirmation that they are going to make that permanent, but I know that CMS, the Centers for Medicare and Medicaid, are working on that. You will still owe your standard cost sharing, whether that's a copay or your 20% for a telehealth visit. Medicare Advantage plans, you're going to need to specify, you're going to need to ask them specifically how it covers telehealth, what the copay would be, how they handle it. Okay. The COVID-19 vaccine is covered. This is less relevant now. I think most people who wanted to get a vaccine have their vaccine by now and their booster. But if you need assistance with that, the ADRC does provide assistance scheduling appointments. I always like people to know how to get a new vaccine card in case they misplaced theirs. You can get one online at www.vaxviewNM.org.
Oh, okay.
Okay, that's where you go to get that. Sometimes, it's a little spotty. I mean, it was just such a huge statewide effort with so many providers. Sometimes people have issues with this. If you're having trouble, you can always call us at the ADRC. Okay, you should have Medicare covers the vaccine regardless of whether you have original Medicare or Medicare Advantage plan, and you should not have to pay anything. Again, I think most people already know this, but when you go to get a vaccine, they're going to ask for your Medicare information, but they're not going to charge you. They're going to charge Medicare, and Medicare is going to cover the costs. Okay, so don't worry that you'll be hit with surprise costs if you provide your Medicare information. That's just so that Medicare can cover it.
Okay.
Also during the pandemic, Medicare is allowing people to refill 3 months supply of their prescription drugs at a time through a pharmacy. Usually that benefit is only available if you get your prescriptions through mail order, but during the pandemic, you're allowed to do that at a pharmacy. Again, I don't know if that benefit will become permanent or whether it will change when our public health emergency status changes. So that is something that we will update people about through our Aging and Long-Term Services Department Facebook page and on our website, which I'll give you the information for that in a minute.
Okay.
Okay. Are there any other general questions right now?
I don't think so.
No.
That's very informative.
Okay, excellent. Oh, you know what? I took all my information out of this because I was making it the template for all of the ship coordinators to use, and I did not put it back in before this, but I will put my information in the chat again for you as soon as I stop sharing this presentation.
Okay.
Again, I encourage you to follow us on Facebook. We're constantly putting up new information, and this is where we put updates on things like what's going to happen to your Medicare coverage based on our public health emergency status. Anything like that is you're going to get the information about it through our Aging and Long-Term Services Department Facebook page. If you're on Facebook, follow us.
Okay.
Oh, and we are not doing that survey anymore. Okay, so I'm going to stop sharing. And my email address is Kris, K-R-I-S, Winterowd, W-I-N-T-E-R-O-W-D, @state.nm.us. And my phone number is 505-470-4443. You are welcome to reach out to me if you have further questions or you want to have a one-on-one counseling session. You have questions about your specific circumstances that you'd like to go over with a ship coordinator. I'm happy to set up an appointment or answer your questions in any way I can. Please don't hesitate to email me or give me a call. You can also always reach someone at the ADRC at 1-800-432-2080.
All right.
Oh, great. Well, thank you so much.
Okay.
Thank you so much for your help, and it was very informative.
Okay, great. I'm happy, and thank you so much for joining us today for Medicare 101.